Hello everyone and welcome back. Hope you've all had a nice coffee break. So we're going to move on now to quality management readiness checklist, and I'm hoping that Fay Swanson's been able to join us. Fay's a laboratory quality manager at Task Laboratory in South Africa with a background in medical technology, and I think she's going to give us a fantastic presentation now, because Task are in the initial process of going through accreditation for ISO 15189. So she's going to be able to really tell you what it feels like on the ground to go through the accreditation process. She's part of the team who are preparing the lab for the process. So we're going to have a presentation from Fay, and then for about 20 minutes or so, and then we're going to move into a Q&A session as we did with the last section. So I'm going to hand over to Fay, and thank you very much for agreeing to talk today.
Thank you again, Isabel, and good afternoon from Cape Town and good morning from wherever else. I just want to say thank you for having me. I feel really privileged to be a part of this workshop. So thank you so much for having me. I have noted that my connection is a little unstable, so I apologize in advance for any connectivity issues. Okay, so I can just get started.
We can't quite see your face, Fay, so if you just angle you, there we go, perfect.
Hello, hi. Okay, so I suppose I could just get to it. So again, yeah, good day, everybody. I've prepared a few slides just on the quality management readiness checklist. And these slides are based on the GCLP guidelines, as well as the ISO 15189 standard that we are adhering to here at Task. Yeah, so all that you're about to see is based on those guidelines. Next slide, please. Okay. So I am going to be covering equipment, staff training, the quality management plan, and last but certainly not least, health and safety measures. Next slide, please. For equipment, all equipment required to perform testing and analysis should be available for staff, and this is to ensure a quality, good output or good result. The laboratory must follow the service guidelines for all equipment in use, and these services should be performed by certified technicians or suitably trained staff who are then able to perform specific services on specific pieces of equipment. Next slide, please. Preventative maintenance must also be performed, and again, according to manufacturer recommendations. Frequency as well. Some instrumentation might require daily, weekly, and monthly services. Some might not. So yeah, important just to adhere to what the manufacturer recommends. Equipment SOPs and operating instructions must also be readily available for staff, particularly those who are operating the instrumentation, as these instructions will include step-by-step guides and maybe even illustrations on how to clean the instrument, how to inspect the instrument, and also validation and calibration information. Okay, so this is my last point. Maintenance logs for the instrument must be saved as well. They must be documented, signed and dated, just to ensure traceability, and also to ensure that only staff that are trained on the instrument and trained to be able to operate the instrumentation are then maintaining the instrument. Next slide, please. So apart from the SOPs and the operating instructions and the maintenance logs, the documentation should also be saved and readily available for scheduled and unscheduled maintenance. So the scheduled maintenance, fortunately, we are nicely able to plan for, but the unscheduled are normally in scenarios where we've got a malfunction or a breakdown of an instrument. It is also important to save the documentation surrounding that service and maintenance. An equipment service schedule, which lists all the relevant equipment items in the lab, which could also then just be an Excel or table format, is very handy, and it would definitely help in planning scheduled maintenance for the year ahead. And as the year progresses, it can be updated, so you're able to keep track of all the numerous equipment pieces in the lab, just to make sure that you leave no stone unturned and all your equipment items have been serviced at the frequency that is recommended. Any equipment items that are not in use should be appropriately marked, just to avoid them accidentally being used to actually generate results. They might not be working in the correct, or they might not be operational at that point in time. Next slide, please. So I've listed a few examples of equipment, but this is only just a few examples. There are so many other bits and pieces that we use in the lab. But it's important to note that our automated pipettes, thermometers, refrigerators and freezers, centrifuges, autoclaves, timers, to your biosafety cabinets and microscopes should be maintained according to the manufacturer's recommendations, and also should be listed on your schedule just to ensure that they are serviced appropriately. Next slide, please. Okay, again, a laboratory must adhere to and document daily, weekly, and monthly maintenance for all equipment items in use. And also the room temperature, or the room that houses the equipment pieces, particularly those that are temperature dependent. The room temperature should be monitored, and those thermometers used to document or monitor the temperature should also be serviced and maintained appropriately. Next slide, please. Okay. Staff training. The laboratory management must ensure that personnel clearly understand their roles and provide the appropriate training. In the laboratory, there are various types of training, all of which I'm about to mention might not be applicable to all staff. So you would need to ensure that where appropriate, the relevant training occurs. A technologist would definitely require technical or process training. Support staff would maybe not have as much technical or process training, but health and safety, quality management system, and laboratory information systems training would definitely be in order for most of the lab staff, if not all. Next slide, please. Okay, so job-specific training must be provided for the duties that the person is responsible for. This training must be provided before the employee or staff member is expected to work independently. Training should also be provided if there are any changes to procedures, or if there's an implementation of a new procedure for that matter. And if repeated performance problems can be pinpointed to an individual, then retraining would definitely be in order. Next slide, please. Okay. So the personnel file, which is kept per individual or staff member, houses a number of items, a curriculum vitae, an updated version, education and qualifications, and licensing or professional body certification licensing, as well as your training records. This would be your initial or training and orientation, your competencies, also initial as well as ongoing, safety training, and workshops like the certification from perhaps this workshop could also be included in the personnel files. Next slide, please. Okay. So it's recommended to have a training and competency policy or SOP, and have this readily available for staff or trainers as well as trainees. And in there, just detail how the competency evaluation will take place. And just specify that competency would be conducted by direct observation of the test performance, monitoring the recording and reporting of test results, review of intermediate test results, QC records review, proficiency testing, preventative maintenance records, and I can't see that last but analyzing previously tested samples. Next slide, please. So the competency assessment, which absolutely has to be documented, would occur after training. And for initial competency, so this would be a new staff member, the person should be reassessed after 6 months. And ongoing competencies for your existing staff complement is recommended that it occurs annually. And again, competency could be measured by direct observation of procedures and equipment maintenance, reporting and documenting results as well. Next slide, please. The quality management plan. So the quality management plan documents the information required to effectively manage laboratory quality from study startup and first sample receipt until the final results are reported. It defines the laboratory quality policies, procedures, staff roles, responsibilities, and authorities. And the quality management plan can be described in the laboratory quality manual. Next slide, please. Okay, the quality management plan must be available to all staff and should be reviewed regularly by the laboratory director. And this plan is designed to monitor, evaluate, and rectify identified sample processing as well as general problems. Next slide, please. The plan includes your key measurable quality indicators, which are critical to and have significant impact on study outcomes. So this would be specimen acceptability. Has the correct sample been received, and has it been received in the correct volumes? Your turnaround times, have they been met or have they been exceeded? And for example, contamination rates, are they within acceptable limits, or have they now been, or are they raised? It also includes details the recording of corrective and preventative actions, and describes laboratory quality control procedures and external quality control. Next slide, please. The plan would also include procedure, or the laboratory procedure rather, for complaints and incidents management. It would detail the scope of testing or the tests that the laboratory is able to conduct. It also includes information on how the quality information is collected and communicated, as well as control activities. Next slide, please. Okay, health and safety. Laboratory management must ensure safety precautions are adhered to according to the appropriate regulations. This is because safety of laboratory staff is and should be of the highest importance. And adequate safety training would definitely ensure the safety, or it would greatly assist in ensuring the safety of all the laboratory staff. Next slide, please. Safety policies and SOPs. So your SOPs should include standard precautions, waste management, chemical hygiene, details on safety equipment, general safety, as well as emergency preparedness, or like your fire evacuation plans, etc. Next slide, please. Okay. All staff must receive training for the pathogens or the biological substance that they are working with, to ensure that it is handled safely. Staff should also receive training for the proper usage of PPE, for example, masks for testing. Staff should receive training for chemical hygiene, the use of safety equipment, transportation of infectious materials, accident reporting, and waste management. Next slide, please. So examples of safety equipment would be your eye wash station, emergency shower, fire extinguishers, sharps containers, automatic fire detection and alarming systems, separate sinks for hand hygiene, as well as your first aid kit. Next slide, please. So you've got your safety SOPs nicely documented, as well as your safety training documented and filed away. The documentation of inspection and testing of your safety equipment is also important. This documentation should be signed and dated, and also stored that can be easily available. So inspection of a safety equipment item would be potentially inspecting your first aid kit to ensure that it is well stocked. Documentation around testing of your equipment or safety equipment would be perhaps checking that your safety shower is operational and that there's actually a sufficient flow of water that is available when needed. The evacuation plan, this must also be documented and available to all staff as well as visitors, and all staff should be trained in evacuation plan. The evacuation routes throughout the laboratory floor should be clearly marked. Next slide, please. Okay, PPE. PPE should also be readily available to staff, and it must be used if there's potential to be exposed to infectious material. Examples of PPE are gloves, gowns, lab coats, eye protection, goggles, face shields, biosafety cabinets, as well as masks. So I'm sure each and every one of us in the lab has a story to tell over the last few months about potential shortages of PPE. And it just highlights, how if we're not able to provide the personal protective equipment, how, we actually are not able to operate. So yeah, PPE is quite essential to the lab staff and to actually producing our results. So PPE should also be available to visitors So, for example, a service technician is coming to service routinely one of your equipment pieces. This technician should have access or should be provided with all of the necessary PPE to safely maintain and service the instrumentation. Next slide, please. Okay. Material safety data sheets must also be available for all the hazardous chemicals in use. And this must include the chemicals that are used for testing, also chemicals that are used for cleaning and just generally in use in the building or on the lab floor. If the laboratory makes use of gas cylinders, it must be stored securely, and this is to prevent falling or damage. Correct storage of your gas cylinder would be in a separate well-ventilated room, and not, for example, in a passage or in a room near a heat source or directly by open flames. Next slide, please. Okay, just to conclude, your readiness checklist, which will comprise out of those 4 previously mentioned components, monitors the evidence of the implementation of your quality management plan. And it's great because it can highlight areas that your lab is functioning or where your lab is performing quite well. But it is also great because it highlights areas where you would need to focus on and maybe do a little extra work. And this will help ultimately, to improve the quality management system of the lab. It will help the laboratory be more ready or more equipped to deal with monitoring visits and potentially inspections, like, for example, an accreditation. But also it ultimately ensures in providing a good quality service to the end user. So next slide, please. Thank you.
Thank you very much, Fay, for that overview. It's a very interesting and useful summary. So we're going to move to the question and answer session. Could you mute your microphone?
Oh, the next one. Yeah.
If you're not, yep, thanks. Okay, so I just want to introduce the panel. So we've got Fay, we know Fay now, and you know me very well now. And Davis was in our last session, but if you've joined since the coffee break, then Davis is from KCRI in Tanzania. He's a senior researcher there. So welcome to the panel. And I can see there's some questions coming in, but I just wanted to address one question from the last session that's come in. And I think it's because I misunderstood the question, but I just really wanted to highlight this. It was a question about master lists and version control. So I think I misunderstood the question. So I think, so Louise Bensouda has corrected me and put this in the chat. So basically that you don't need to version control the master list document. So I think I thought it was whether the versions of the documents on the master list had to be version controlled correctly. So hopefully everyone's seen that in the chat. So thank you very much for that, Louise, for correcting that for me. Okay, so let's come back to this session. It's been some good questions already, so please keep your questions coming. So someone's asked if there's any advice for a situation where equipment was donated and there's no service contract for this equipment, and also how they should hold the service contractors accountable when they do not manage the budget. So there's quite a few questions within this question. So should we take that first one? As someone else has said that donated equipment is a problem. Fay, I don't know if you want to take that question. It's not something I have experience of.
Isabella, do you mind just repeating? I didn't get the whole question. I'm sorry.
So any advice where equipment's been donated and there's no service contract for that equipment and how you should handle that situation? So if it's been donated from a partner site.
Okay. So for example, if you do have a donated piece of equipment, you could still contact the manufacturer, even though you don't have a service contract. You would probably have to pay, you know, per service or per call out, and familiarize yourself with the manual and what is required, because even though the piece of equipment is donated, it is still going to be used as part of your laboratory, you know, generating results. So from the time point that you received it in the laboratory, it then should be maintained according to the recommendations set out by the supplier or the manufacturer. So if it is donated, I would definitely reach out to the manufacturer, try and download, if there's no operator's manual, try and download and get the operator's manual, just to ensure that, you know, from the time point the equipment is placed in your laboratory, that it is maintained and kept as it should be.
Thank you, Fay.
If that answers the question.
I think it does. I guess that there was a bit more to this question, that there's difficulty in getting sort of training on that equipment and things like that. I suppose there's not a vested interest by a company if they haven't actually received any revenue in that country, and the equipment's come from abroad. So I guess maybe you can try and get a partner site to come over and give you some training would be one way around it, to ensure that you've got documented training. Davis, do you have anything to add to this conundrum?
I think it is one thing which is important to understand when it comes to equipment. In most cases, sometimes you might have a partner site wishing to donate an equipment, but when you look at the situation around your location, that one, you have to assess yourself whether you have local engineers who will be available to support you when it comes to maintenance, but also in terms of contract agreements. Because you have a partner maybe from the US, and that from the US, they have service engineers on site up there. But when you bring that equipment, for instance, here in Tanzania, and the service providers are merely from America, so it would be a big difficult for us to maintain that piece of equipment. So at times, I think it's important also, before just accepting a donation, you should put some effort trying to see whether, if we receive that kind of equipment, will you be able to maintain that piece of equipment? Do you have the resources? Do you have the money? Otherwise, you are going to fall into a trap where it just be causing problems, because auditors, when they visit your site, they cannot take that as an excuse, because you had the opportunity to figure it out whether you need that equipment or not.
That's a really good point, Davis. And I think also because service contracts can be very expensive, so it all has to be taken into account when you're budgeting for your lab. Okay, so we've got a few questions here around competency. So some people asking if there are any competencies that can be valid for 2 years, and who is responsible for the competency validation every year, head of the lab, technical supervisor. Fay, I don't know if you want to start off and take that question.
So in our lab, we've got lab supervisors, and they are responsible for the competency, initial and ongoing competencies. And it would be either the lab supervisor, and depending on the assay, perhaps even the laboratory manager. But for the most part, it would be our lab supervisor who is a more senior and experienced laboratory technologist. As far as the 2-year time frame is concerned, I have heard of 2 years for ongoing competencies. at the moment, and definitely in the GCLP guidelines, I have seen the 1 year ongoing competency. So we are sticking to the 1 year for now, but I'm sure, you know, if it is ongoing competencies, I have definitely heard, I just haven't seen, so maybe somebody else can help me out here. I have heard of 2 year ongoing competencies.
Davis, do you have anything to add on competency in the lab?
Yeah, I think it all goes back to what have you said in your policies, because normally we are normally following what is written either on local guidelines or international guidelines. In these cases, Tisha has said Faith, I don't know, I don't remember if I mentioned correctly, but you can follow guidelines like GCLP, but also you can have your own local guidelines as long as they coincide with what the international guidelines say. So it's all dictated by how you have mentioned in your policies the frequency of competence assessment. Especially, it also depends on the activities. You know, there are some activities which you perform more frequent than others. So it also goes back to what do you say in your policy?
Absolutely. So again, coming back to doing what you say you're going to do and how important that is. And then if you find something becomes unmanageable in the way you set it up, to change that policy really and document that. I think sometimes it can be difficult because an activity that you don't do very often. So for instance, an incident in the lab doesn't happen very often, but you need to know the procedure to respond to that. And you need to make sure your lab staff are trained, but because they're not obviously doing it very often, you might need to make the training for that competence to be competent more often to ensure that staff are able to respond, because obviously things that you do routinely you will remember much better. But yes, basically you have to think about what you need to do and write it down and then do that thing. So again,
sorry, if I may add on that, maybe we will discuss it more tomorrow, but also it depends on the way when you perform these like audits. You see a certain procedure, when people perform it, they tend to produce more errors or mistakes. So those quality indicators will dictate on the frequency, how often people should be retrained on that particular assay or that particular procedure.
Absolutely. So we'll take a few more questions then. So someone's asking here, does the QMS apply to teaching laboratories as well? I think that's a good question. I'm not sure I can answer that one. I don't know if one of the other panel would like to take it.
I don't know. You know, sometimes when in the first instance, we have to figure out why are we following this. It's either you are following the ISO 15199, which is primary purpose is to make sure that the results you are releasing will go to you to intervene the treatment of patients. So whatever you are producing, which is not of high quality, it might impact the treatment. But also when it comes to GCLP, you must also follow the standards, because whatever you're going to generate, data you're going to generate is going to have an impact. But I've seen that in most teaching labs, they are not that much stringent when it comes to following the QMS. So it's just a matter of training people. You might not follow those kind of stringent procedures, but it's important also to start learning the whole concept of quality from the time people are being trained.
Yeah, I think that's true. And I guess, so, you know, some aspects of the QMS that wouldn't apply to teaching labs, but some do. So for instance, maintaining equipment so that people are trained correctly, and safety and PPE and things like that. So perhaps you could make a tailored version of it. I don't know what people think about that. Fay, do you have anything to add? Teaching laboratories. I'm not sure if Fay can hear it. Okay, so we've got another question here. QA managers and lab managers perform lab staff competency assessment. Are they also subject to yearly competency assessment, and who is it that does this? That's a great question. Fay, do you want to take that? Are you able to hear me?
I think I got the question, and I hope I'm going to answer correctly. So in our lab, because the lab manager also needs to be reevaluated, we would then have, in that case, the lab supervisor evaluate the lab manager. That's how we go about it in our lab. I don't know if Davis would agree with me.
Davis, what do you do in your lab?
Yeah, there are those circumstances where you have no one to train you because you have to assess competence of other people. But in this case, what we normally, but also it goes back to what you say in your policies. In one of our policies, what we say is, if by any chance you don't have someone who can assess somebody's competence, there are other ways on how you can do that. One, if you are participating in these EQA schemes, external quality assurance schemes, whereby your performance is being measured based on other peer labs, you can use that as a means of assessing your competence. But also you can assess using the instructions or manufacturer or whoever develops that particular assay. They have their own QC standards. Then you can try to follow that and see if you can reproduce that. That can also be used as a way of trying to assess somebody's competence in cases where you don't have somebody to assess your competence.
Thank you. I think you can also do reciprocal sign-off. So I guess you've had a discussion, 2 senior people, or maybe 3 senior people have had a discussion and signed each other off to agree the methods and the way that that technique is going to be carried out. That also can work, I think. Okay, so we've got some more questions. Sometimes equipment is phased out, and new equipment is brought in. How do you handle the phasing out of that old equipment? Fay, do you want to take that one?
Jeez. So phasing out, oh goodness. So I would imagine you'd run them simultaneously until the new piece of equipment is obviously deemed fit for purpose and validated and, you know, in good working order. I don't know, would the old piece of equipment still need to be operational? Or will it be used in some way in the lab? But if it is going to be phased out, then once the new piece of equipment is up and running and validated and, you know, certified for use in the lab, yeah, it should be good to go.
Do you want to add anything? Davis is keeping quiet on that one.
Okay.
You're on mute.
I just wanted to add one point there, which is cross instrument validation, because if you have results from previous machines, you want to have samples that you will run in between both machines so that you can compare them in case of future.
Yeah, I think that's really important. Can I just ask that everyone mutes their microphones? We're getting some background. Thank you. Yeah, that's great. And then we've got another question here: proficiency testing versus competency assessment, which one is better? Fay, do you want to address that?
So like David said, the proficiency testing could form part of the competency assessment by monitoring the results that you obtain. So I wouldn't say that I think they go hand in hand, basically.
Yeah, absolutely. Davis, do you have anything to add on that?
No.
No, it's good. Okay, so we've got a question here about how does one keep track of PPE maintenance? These are mostly not durable materials.
Come again?
I'm not quite sure. How does one keep track of PPE maintenance? These are mostly not durable materials. So I'm not sure whether it's like quality of whether a lab coat is still functional or because I mean, I guess things have, usually most PPE is single use except for lab coats. So I don't know if this relates to shortage of PPE perhaps.
Yeah, I think I would follow the recommendations from the manufacturers.
Absolutely.
Sometimes you have these PPEs like the one which can be reused, but those ones which cannot be reused, they should be used once, then they should be used once. But PPEs like lab coats, you have the disposable lab coats, you have these reusable lab coats. So I think it all goes to what kind of PPE are you referring to?
Yeah. I think if there's specific questions like that we aren't able to answer or we don't quite understand your question, then I'm sure panelists would be happy to take questions people want to email after for advice on specific things if we can't really address every question. So another question here, what can be the actual next state of calibration for a newly acquired piece of equipment, so pipettes, cell counting machine, temperature monitors? So I guess, Davis, do you want to have a go at this one?
Can you repeat the question?
What date should you set for the next date of calibration if you've just got a new piece of equipment?
I think when you receive a new equipment, it has the manufacturer calibration settings, of which they will say maybe this machine is valid, these calibrations, factory calibration are valid for maybe 1 year or 2 years. But also you have to check with the standards. What does the standards say about that particular piece of equipment? Because when there are two things which people normally confuse. We have calibration and verification. So even if the machine has been calibrated, but also you want to make sure that you verify to see that what it says it does, it is true what it does. So that's also important to see and to observe when you are getting any equipment. But in terms of maintenance, like preventive maintenance, normally the manufacturer will give you a warranty for maybe 1 year or 2 years, and then after that, that's when you start. Maybe you have an extension to that warrant, so that you can start using the PM services. And yeah, but as long as the machine has been validated, you can start using it using the manufacturer's calibration settings.
Great, thanks. That's a great answer. Okay, so we've got a question here. Is there any case where the equipment maintenance service could be postponed? So maybe Fay, do you want to answer that? I'm not totally sure of the context, but I suppose it could be when perhaps an engineer isn't able to come to the country until maybe a month later or something like that. I think that's what that means. I guess what should you do in that case? Fay, can you hear me? Davis, do you want to take the question maybe? I don't think Fay can hear me.
Yeah, I think now we are in the right time. You know, with the COVID situation, airports has been shut down, people under lockdown, engineers under lockdown, and we have equipment which are supposed to be serviced during this time when people are under lockdown. So in those circumstances, definitely you have to postpone the equipment, but also you have to follow the manufacturer recommendations, like daily monitoring of the equipment to see that is it still performing according to the recommended performance standards. So, but that, because if you are supposed to do a PM maybe in June and that was not done, basically when it comes to quality management, that's a finding, or that's I think I say it's an observation. So in that circumstance, you have to write probably a quality improvement statement that this the problem is an outlier. So you have to write the corrective actions for that. And yeah, so basically under circumstances whereby there is no option, that can be underwritten. You can communicate that to your sponsors, You can have the email from the service provider to explain the reason as to why that was not done, and also say when will it be done.
Yeah, well, that's a really pertinent point at the moment, as you said, Davis, with COVID lockdowns, etc. And I think the most important thing is document that and the reason, and then also you've got your internal or your controls for those machines each time you use them, and to make sure that those are still passing the validation. Okay. So this is a good question. So for temperature logging that's recorded daily, is it acceptable to record this data at different times of the day, or must it be on a rigid time schedule? Fay, do you want to take that? I don't know if Fay can hear me because she's not responding. Oh.
I was on mute. I'm sorry. If you do not have what do you call it, a temperature monitoring system, it would be great to take the temperatures roughly at the same time each day. You know, we all work in the laboratory, so you know, some time you just don't get there. As long as you do remember to record the temperatures on that day, I would imagine it would be acceptable. But as far as possible, you know, try and record it at the same time frames.
I mean, I guess it depends if that temperature is varying a lot in that room, and perhaps if the air conditioning is not working very well or whatever, then it might be important to take more readings. And also it's useful to have a column which says what time it was recorded, so that you've got that information, I think, as well. So if you see a big variation because people recorded it in the morning and the afternoon, then, and if you feel that it might need to be recorded perhaps twice a day, if you feel there's a big variation in that space. Davis, do you want to add anything to that?
Yeah, I would say yes, it all goes back to what are you documenting? What are you saying in your policies? For instance, if you say you are going to record twice a day, AM and PM, we have seen that sometimes when you say AM and PM is a bit confusing, because AM ends at 11:59 and PM starts after maybe 5 minutes later. So if you don't document that clearly, somebody might record the temperature at 11 AM and do the PM recording at 1 PM. So according to AM, I mean, if the dual recording of temperature, that person is fine. So what we, in our lab, what we decided to do is to specify exactly what do we mean when we say AM. So AM starts from 7:30 AM to 10:30 AM. And PM starts from 3 PM up to, it depends on, up to around 6 PM. So that you know exactly the timing, the range, at what time do you expect somebody to do that? Because sometimes that is considered as a deviation if you don't specify exactly when did you record the time. But also to get rid of the variation in temperatures, we have temperatures which can record minimum temperatures reached from the time you did your last recording, and the maximum temperatures reached after you did your maximum last recording. So that will tell you the performance of your fridge or refrigerator at that particular moment, or the room temperature. So you record your temperature, the exact temperature, but also you also see the minimum temperature it has reached since your last recording, and the maximum temperature you have recorded, the equipment has recorded from the time you did the last recording, and then you reset that. So your actual temperature recording now will become your initial your benchmark. So next time you come, it also see from that time you reset your thermometers. How far has it gone, upward or downwards?
That's a really good point, Davis. A really good way of capturing that as well, that data, if you haven't got an automated system. I think one other thing that might be worth just mentioning here is that somebody senior does need to sign off the temperature records to make sure that they have been completed, etc. And if there's any deviations, that there's a reason recorded for those, because otherwise they can get picked up in audits. Okay, what other questions have we got? Between calibration and verification, are there special bodies or institutions that are responsible for these, or are they done internally? Fay, do you want to start taking that, and then we'll come to Davis? Or Davis, do you want to take that first?
Sure. It depends on the lab itself. If the lab is well equipped, it can perform both calibration as well as verification. But at least most labs, they have the capacity to do the verification and perform the external calibration from other labs outside or from the service providers. So like for the equipment such as thermometers, what we do normally, you have your NIST calibrated thermometer, a standard thermometer which was sent for external calibration, and then you use that to verify your other thermometers which you have. The same goes for timers. You can do that, or the weighing balance, because you have your weights which have been externally calibrated. Then you can use that to calibrate your balances, but also to do the verification to see if they are still performing according to the standards, specified standards. The same goes for the pipettes. You send them for external calibration, but also when they are sent back, you can do the verification to see that they are still performing according to specified standards and requirements.
Yeah, that's a great answer. I think it's basically tailored to the lab, and also sometimes it's a financial constraint because some of these calibrations can be expensive, but then there's also a time constraint too, because they can take a lot of time. If you've got a lot of pipettes that you need to check that they're in range, it can take a long time. Okay, but again, whatever you said you're going to do in your documentation, then you just have to do it that way. Okay, someone's asked if equipment maintenance and daily QC is difficult in settings where reagents are in limited supply, can the laboratory devise or their own maintenance plan that's different from the manufacturer's protocol? That's quite a difficult question to answer, I think, because it's probably a bit dependent on what specifically, but I don't know if Fay's still with us, but Davis, do you want to have a go at that one?
I think if you have a benchmark where you can validate your in-house procedure and see its performance, then I think it's allowed to do that. But if you don't have a benchmark of where you can compare your in-house procedure of doing the maintenance, then that would be a problem.
Okay, so does GCLP and ISO 15189 encourage inbuilt thermometers for recording temperatures for a piece of equipment? I'll just see if Fay, you there? No. Okay, Davis, it's you and me now, I think.
So I would say that the built-in thermometers from equipment like refrigerators or incubators, we cannot rely on that. So normally we have to add a separate thermometer to make sure that what the equipment says it reads, that's what actually you are measuring. We have seen a couple of times whereby the displays on the fridges or incubators say it's 37, but when you actually measure it using an external thermometer, you find that it is not measuring what it says. So it's a good advice to add an external thermometer on that particular piece of equipment so that you are sure that what is displayed is truly what it is saying.
Absolutely, and you see this really commonly on hot blocks. I think it's a good example where they don't actually record the temperature that they say. And I guess the key thing is coming back to the point that Davis made earlier, that you've validated that external thermometer against your calibrated thermometer that's been sent away for external calibration, so you can really trust that thermometer that you're using for your validation. Okay, so we've only got a couple of minutes left now for this session, so just see if there's any more questions. Okay, so someone said here, regarding instrument calibration, some researchers in Africa keep saying that even though a centrifuge, for example, is really old, like more than 30 years old, we don't need any calibration as long as it keeps serving its original purpose. And what does the panel think of that? Davis, I'll let you take that.
I disagree with that statement. The only way we can say that the equipment is performing according to its original factory or settings is after you have verified that it is doing that. So for a centrifuge, we have to make sure that if it is a refrigerated centrifuge, we are sure of the temperatures which that centrifuge is operating. But also for the revolutions, you must use the tachometer to make sure that when you set it to rotate at 300 RPM, it actually rotates at 300 RPM. So you cannot say because this is an old equipment and then I think it as long as it is rotating, you know, these are some things which you cannot say. 300 or 3,000 revolutions per minute is different from 2,800 revolutions per minute, and you can barely notice that using your eyes.
Yeah, so I guess if you want to improve things in the lab, then you've got to at least check that those things are doing what they say they are. Someone's asking about lab cleaners being part of the health and safety training. So I think this is an important point in terms of external people coming into the lab. So you've got your engineers, you've got visitors, you might have students, etc. And they are also part of your taken into account in your quality policy, quality manual, and you know how you look after those people coming onto your site. You're responsible for them whilst they're in the laboratory space. So for instance, you'll have a form for your engineers coming in and it's filled in and you've explained to them the health and safety policies while they're in that lab space. And the same for cleaners, they will need to know, someone needs to explain to them, obviously, certain things they can't touch in the lab, etc. So it's important that everybody, I think, that's coming into your lab space is accounted for. You know who's coming into your lab space and that they are protected in health and safety and given appropriate PPE if required. Davis, do you have anything to add to that?
Yeah, I think when it comes to safety, everybody who is working in the lab must follow what the health and safety policy says. And when we work in the lab, we work at different levels. Some they just work as cleaners, some they will go as far as maintain pathogens of concerns. But anybody is subjected to infections as long as they don't follow what the policies say. So even if a cleaner does not perform any duties related to analyzing the samples, but he or she is entering the lab, she's working close to she's doing her work where activities are being done. So he or she must also be well trained on the health and safety, but also the restrictions will just be on the how far can she go as far as working. That's why we have this delegation log, whereby on that delegation log you have a list of all your lab personnel and what they do in that lab.
Thank you, David. So we're running out of time here, but we've just got time perhaps for just a couple more good questions. So one is, how do you check the temperature of a centrifuge? So, I mean, that is generally done by the engineer. And I don't know of a way of doing that in-house. Davis, do you know of a way of doing that? I guess you could put the thermometer inside the centrifuge at the bottom, but that's not ideal.
Yeah, I think engineers, they have their own specific equipment they use. That you have the infrared thermometers, or you have thermometers which you can put a sensor inside and then it can transmit, and then you get something outside without opening that lid. So you have specific thermometers for that, not just the usual glass thermometer. It will not be possible. So you have specific equipment for that.
Okay. And then just the last question, and there's still some more questions, but we're running out of time. So how do you perform accuracy checks during equipment verification if there's a scarcity of certified reference materials? And I think that's a really good question.
Come again?
So how do you perform your checks if there's a scarcity of certified reference materials, if people can't get hold of them?
I'm just putting a wild guess that if you don't have referenced materials, but also you have some materials which you have used your reference materials to work on them, and then you have proven that those materials are as said. For instance, if we want to do a parallel testing, for instance, for a particular assay, and then we have the standards, but also you have some clinical materials. In those cases whereby you have clinical materials which has been tested and then they have been verified as correct, then you can use those also in place of those reference materials. So it's also possible to use biological materials which are known to be, if it's a sample which is positive for a particular thing, then you can use that as a reference material also. I don't know, but there's also that possibility.
Okay, so I think we're going to draw this session to a close now. I just want to say a big thank you to Fay for presenting, and a big thank you to Davis for some really fantastic responses to some of those questions. And